we keep their functional status at a higher level. If it's at a higher level, they're able to do more things for themselves at their home to maintain themselves. They can manage their own laundry, they can make their own meals, they can, change the sheets on their bed, which all seem like little things to us, but become really important to them in wanting to be what we all want to be, which is just normal, right? So people living with AIDS and HIV, they want to be normal. And their functional status is really important in maintaining that. Emotional status is interesting, and functional is too, because if somebody gets diagnosed with HIV, you have to look at what things are impacting their functional status. Emotional status is really an important piece of that, because if this is somebody who already suffers from bipolar disease or depression or anxiety, and they now have discovered they're going to be living with this chronic illness called HIV, that people are going to find out and maybe ostracize them, make them feel uncomfortable, or they're going to have to feel like their church might not like them anymore because of this, because they now can no longer hide maybe who they've been sleeping with, in a sense. That's all really important in how somebody manages the onset of this disease, as well as the progression of the disease, because the more symptoms you get, the harder it is to feel like you have control over your life and are engaged with what's taking place with your life and want to be out there doing things for yourself. So it's really important that if people have issues with their emotional status, that they are well taken care of, that they have the right resources behind them, from support systems, a therapist, a psychiatrist, all of those things, so we can keep those in control as much as possible so that they can focus in on how to stay healthy and how to manage and maintain their health for themselves. Other things to consider is something I've mentioned, which is the support system. I've been reading more and more about this, and it's really becoming important for people to have a strong support system. That may be one of the most important things in having a good outcome for people living with HIV and AIDS, because if they have that strong support system, they tend to have better coping mechanisms. And if we have better coping mechanisms, it goes back to having a better ability to take care of ourselves and manage things from a day-to-day situation. Costs, it's really important for us to also look at is what kind of insurance do they have? Does their insurance cover a lot of these medications? Do they have an income that will support, the different co-pays that they'll have to have for the different treatments along the way? If their disease progresses enough that they get a lymphoma or more opportunistic infections, how will that impact their ability to care for themselves and manage their finances? And finances is one of those big stressors in our life. And when we have big stressors in our life, it affects our immune system. And people with HIV and AIDS can't afford to have stressors in their life that affect their immune systems, because this is all about their immune systems. So it's really important that we figure out ways to improve their immune systems. So we want to help figure out ways to decrease some of those. Quality of life. One of the other things that I've read along the way is that quality of life, again, is a personal perception. It's a personal idea of what you want in life and where you want to go and how you want to see your life defined. Most people that I've met do not want to be defined by the disease that they have. They want to be defined by the person that they are. And people living with AIDS and HIV, I think it's even more important that they really, really have the ability to express what's important to them and have their caregivers hear and listen to who they are and what's important for them for a long-term success of managing this disease. If we don't stop to listen to what their quality of life is, what's important for them in this, we've missed the boat as caregivers. And I think most of us are going into this because we do care about people and we do want to make a difference in their life. So I think it's really important that we stop and look at what we can do to help them maintain that over the long haul of this disease. If we're looking at 20 or 30 years, we want to know what their goals are for each step along that way. And we're going to have to stop and re-look at what are those goals and have they changed with how the symptoms progress or the symptoms change. The good thing is that, in another 10 years, we may have even more medications that help manage this disease with even fewer symptoms, and that's nice to know, because in 10 years, we've made a huge leap in how the medications are affecting people. And if we can keep those CD4 counts high and the viral load low, then again, we go back to being able to have fewer symptoms from the disease, which of course improves their quality of life as well. Mortality, this is something, of course, which shortens or lengthens the life. Again, you're looking at what other diseases do they have that could impact this. If they're an alcoholic or an IV drug abuser, they're just as likely to die from the effects of that disease as they are from the HIV or AIDS, and helping them get control of that so that they can have better adherence to their drugs is probably as important as anything. So the first thing you may have to do is figure out how to help people, find resources to manage that. Because if they're drinking or using IV drugs, it's going to be really hard for them to use their heart medications so that they can, maintain a good CD4 count and not have opportunistic infections. And the IV drug abuse and the alcoholism does the same thing. It also decreases their immune system. So they're more likely to get things, as well as different diseases like tuberculosis and hepatitis B, which are just as potentially deadly as what they already have. Actual symptoms, anorexia and weight loss is probably one of the first things that a lot of them notice. The weight loss itself is a part of the disease. It's a wasting syndrome. The nice thing is today, with the, sooner that people are getting identified as having HIV and the sooner that they're getting treatment started, we're not seeing as much wasting as we did in the beginning. These people could get really thin, and they could be eating and they still were just losing more weight than they were eating. And so their muscle mass was going down, and it was really causing issues and problems for them to manage at home in a safe manner. The anorexia, again, is a piece of the disease, but it's also sometimes some of the medications that we give them. So occasionally we'll use appetite stimulants. For HIV patients, cannabis is actually a really good use, and we often call it Marinol in a tablet form, which is something you can actually prescribe more easily than you can the little green leaf. But it's actually proven very positive for helping with improving appetite, not only with HIV and AIDS, but also cancer patients. So sometimes what has helped one has helped the other, is what they're discovering. You want to make sure they eat small, frequent meals, high-protein food, and all of those things are things we can pass on to people. Fatigue is kind of this all-encompassing issue or problem that they don't really know or understand what causes fatigue. They know that the disease itself may cause some fatigue. They're not really sure why it does. They think part of the fatigue that the disease itself causes may be similar to other viruses, like when you get a cold and you get really tired and you just want to sleep for 24 hours. Or when somebody's diagnosed with cancer and they get really fatigued or tired. So there may be some similarity, but they've never really discovered in the other ones why that is caused either. My personal feeling is fatigue is kind of your body's way of telling you it needs to heal and improve its immune system, because we do our most repair at our cellular system when we're sleeping. So if we have an attack on our body, some disease that's taking place and our body's tired, that's because we need to get some sleep and improve that cellular damage while we're sleeping. This symptoms also are often from the treatment itself, can often cause this fatigue to happen. The good thing is some of that fatigue will wane after they've been on it for a few weeks or a couple of months. The things that we like to teach are making sure they have good sleep hygiene habits. Maybe a sleep medication, although you have to look at what their liver function is to see if they're able to handle a sleep medication, and that's really one of the last resorts we're going to look at. We're going to look at things like melatonin first, sometimes valerian, although again you have to look at what medications they're taking, what their labs are looking like to make sure there isn't any adverse effects that we have to worry about. One of the things that is showing to work is some aromatherapy. Things like lavender and lemon balm scent can sometimes help people sleep a little bit better at night. But you want to look at the causes of why they're not sleeping. Is it the distress of the disease itself, the anxiety that's produced by it? Have they had a increase in symptoms all of a sudden? Is that what they're worried about? Is there a fear that all of a sudden this is going to change into something worse? So all of those things can affect how they're managing their sleep. And you just want to deal with each one of those based on that model we were discussing earlier. Nausea and vomiting, probably should put oral sores in here too. Nausea and vomiting, the disease itself, there's some neurological issues that can cause it. I would say that a lot of it is caused by the medications. The good thing is that the advance in medication treatment has actually decreased some of these symptoms, which has been a boon for many of these people to continue to work and manage their daily lives. Because if, every time you smell a strong odor at work, you're suddenly feeling like you want to throw up, it's very hard to stay at work. So these things have really helped. The other thing is with a lot of the medication that they're treating with nowadays, again, if they can stay on it long enough, more than a month or so, they usually can get past that effect from it. They do use anti-nausea medications for some of this, things like Compazine or Zofran. Zofran is a really nice anti-nausea medication because it doesn't come with the sedation that things like Compazine or Phenergan do. So patients tend to like it because it doesn't interfere with their day. They can take it. They even have a sublingual form. They can stick it right underneath their tongue while they're at work. It's not a problem, and they can go about the rest of their day and have good success. And Zofran was actually one of those drugs that was originally first used in post-op nausea and in cancer nausea, and of course discovered it worked great for these people because they're just like cancer patients. They want to go back out and have a normal life and have their jobs and purpose and their life fulfilled. So the other thing that really helps with nausea and vomiting is small frequent meals. You want to stick to things that are easy to digest. Distraction actually helps, so if they keep busy, that'll help in itself. And again, smoothing aromatherapy will help as well as a distraction. So those are all useful in managing it. Dysphagia and odynophagia is the difficulty of swallowing itself. The odynophagia is a painful swallowing. The painful swallowing often comes up with the oral sores that they will get with HIV and AIDS. They get the oral sores regardless of the treatment. So even if they have their heart treatment taking place, sometimes they still will continue to get oral sores, and they get them from different causes. Sometimes it's candidiasis, and sometimes it's a hairy leukoplakia that occurs, which can cause a lot of pain in the mouth, sometimes all the way down into the throat. And they have different things that we use for the painful swallowing. There's actually what we kind of refer to as a slurry that has Benadryl and Maalox and a little lidocaine mixed in, and it kind of coats things. But then there's also treating the actual cause, which would be giving things like, yeah, that's an interesting thing too, from a naturopathic thing, is they're discovering that garlic paste will kill off Candidus albicans. So yeah, so you can, if you don't want to take the nasty tasting nystatin in your mouth, you can try taking some garlic paste, and at least you can pretend that you're eating something good. So that's working in that neighborhood as well. For difficulty swallowing, they look at thickening the liquids with things like gravy and thicket, which will thicken any fluid pretty much. And then you usually need swallowing eval done by speech therapy to help determine how much thickening they need. The dysphagia is sometimes because of the pain. It makes it kind of difficult for them to want to swallow, but a lot of times it's a neurological event that's taking place that's caused the problem. So, and the treatment can cause some of this, but usually it's a symptom that the disease may be advancing when they start to have more problems with this. There's lots of additional symptoms. We have cognitive impairment. The nice thing with the heart is there's been a decrease of about 30% chance of them getting HIV dementia complex. This used to be, a pretty severe problem of the disease, and it really affected, you were looking at people who were 35 years old and they had dementia like they were 80. And it was really tough on families to manage and deal with, because they could get aggressive, they could get really anxious, they could get fearful. And with the advance of the medication changes, and the drop in this, now it would only be a sign of pretty advanced disease progression. So if people are being able to maintain good adherence to their medication, they're thankfully not going to have as many problems with this. That cognitive impairment also can affect their functionality, because depending on where it's hitting the brain, it may impair their ability to walk, for their ability to use their hands, their swallow. So it's important to try to keep this one at bay. Some of the medications are showing some effect now on actually being able to improve this in people, the newer ones. So when the pharmacist was discussing them, this is a good sign. We like that. Pain is kind of an overall. People with HIV and AIDS, they often have arthralgias or myalgias, painful joints and muscles that are caused from the disease, the medications. It's really important to use regular movement and exercise, to get regular physical therapy if it's needed. I would say physical therapy is probably one of the more important things that we can do to keep people functional along the way, because it helps with their balance, it helps with their mobility, it helps with their ability to dress, and all of those things become important in maintaining a normal lifestyle. Distraction and biofeedback are also really helpful for pain. And distraction can be something like putting ice on whatever's hurting, or heat on whatever's hurting. It doesn't have to be a fancy medication, doesn't have to be a pain pill. It can also be just actually engaging in an exercise program, because the more that you can exercise, the less painful things can be at times. So those things become important in managing that. Biofeedback is something that you'll see in some of the pain centers. If people are having a lot of problems, they'll send them to a pain center, and then they'll start to do some biofeedback mechanisms so that they'll help kind of retrain the brain around how to manage the pain. And again, pain is just like we were talking about earlier, perception. And it's that person's perception. So how I perceive an 8 out of 10 pain is not going to be how anyone here perceives an 8 out of 10 pain. So when you're asking about somebody's pain, it's really important to be open to their explanation of that pain. It's just not very useful if we put it in our terms. It's more important that we hear it in theirs. And part of that is because we've all been through different experiences. If the worst thing you've ever had is a sprained ankle, that may be your 8 out of 10 pain. But, if you've had a bone injury like a fracture or surgery on a bone, that causes way more pain, and suddenly your 8 out of 10 pain has shifted for yourself. So that's one of the reasons why how we interpret pain becomes different. Again, it goes back to those support systems and those coping mechanisms that we have. How well we tolerate pain can often be how good are our support systems and how good have our coping skills been from childhood on. So that's important to know. Impaired mobility, we've talked about that some. The disease process is usually what causes this to become worse. You look at assistive devices such as walker, canes. There's all kinds of things that you can use for eating. They've got special things that they put onto utensils and different bends they put into them to all help make it easier. Physical and occupational therapy, again. A lot of people with HIV, if the disease progresses, often ends up with home health, not only for nursing, but for PT and OT. And I actually worked in that as well, home health. And it was fun to see these people be able to improve and go back to more normal life after they'd had some change from a really severe opportunistic illness, and then be able to go back to work. So that was good. Visual loss is one of those things that if they've had an acute visual loss, this is usually a sign of a progression in the disease and needs to get treated immediately. Very rarely will the medications cause, or there is an immune rapid response uveitis that they can get, that can be because all of a sudden we're improving their immune system and they can get problems with it, and that is treatable by anti-inflammatories. But usually it's a sign that, again, the disease is progressing and maybe they're having a brain infection or from one of the opportunistic infections, and you need to look at, again, what can you do to get that treated immediately so that they don't lose their vision. Because if they lose it, it's often not able to come back, because a lot of our eye issues don't regenerate in the same way other cells in our body do. So a little important, if you're suddenly doing something with somebody and they go, oh my gosh, I can't see out of the right side of my eye, you want them to see their doctor that day or the ER. Sexual dysfunction is a tough one for us as caregivers, I think, and for sometimes the people that we're taking care of that have HIV and AIDS. They always already feel like people are going to look at them differently, like somehow they've slept with the wrong person, or they've done the wrong thing, or they haven't used the right protection, or they whatever. They feel judged and feel guilty, whether that's right or wrong. Those are the issues and symptoms that they go through. And these things can affect their sexual dysfunction, or affect sexual dysfunction. If you don't have a good body image because of the wasting or the nausea and vomiting or the other issues that we've talked about, it's really hard to want to make love with somebody because you don't feel like yourself. But those things are important in providing a sense of well-being to people. And really, honestly, the most important thing that I could tell any of you as potential caregivers is to never be uncomfortable with them needing to discuss it, because it's the most uncomfortable thing for them to discuss, but it becomes the most important for us to discuss. I will say that that was probably the most helpful thing I learned as a nurse, is to be really comfortable having these discussions, because it's not about, again, what I think my love life or my sex life should be. It's about what they think, what they're getting from it.